I'd really be curious, Khaled, having spent some time in the CDMO world and now that you're working as a consultant, right? What's your assessment of the maturity of the outsourcing industry as it relates to analytical development for mRNA and process development as a whole? And where do you see the greatest room for growth there?
So, yeah, I've been on both sides of the fence. I
Yeah.
hired CDMOs for other modalities and worked for CDMOs.
Mm-hmm.
The main concern that I have is communication between the sponsor and the CDMO.
Yeah.
A lot of times the sponsor comes in to the CDMO on a shoestring budget. We have this idea, we got the funding. How can I get my mRNA so quickly so I can put it in the clinic and get an answer?
Yeah.
I wish I have a good answer for that because I would be extremely rich. But the sponsor comes to the CDMO and goes, can I leverage your knowledge from other sponsors? And that is a tough position to put a CDMO in because all of them signed a confidentiality agreement. I cannot share anything. And I'm always amazed by how sponsors keep pushing the limit on that, knowing that they also know that they signed a confidentiality agreement.
They don't want their info getting out either, right? Yeah.
and what you hear is, well, you don't have to put the customer's name. Just tell us, this.
Yeah.
But so to combat that, if you listen to the sponsors, they just want an assurance that if I go with this CDMO, you are able to make what I want. Okay. And, I know CDMOs invest a lot in facilities and equipments and all of that, but it really would be important for CDMOs to do a few runs on generic models to show that this is my data, this is what I can share with you, this is my, that we produce and get out of this cycle of confidentiality.
Yeah.
Also, and also the other thing that in terms of communication, I see a lot of sponsor comes and said, I believe in my process, so I'm going to tech transfer it and you're going to follow it. But also, you have to switch everything to how I want it. That, that puts a lot, and without losing any of the timeline that the sponsor is telling you, I mean, the CDMO is telling you, which gets a little bit difficult because tech transfer takes time and people need to understand that. So this is become, I think there have to be much more sit down of clear expectation and communication and what you can leverage against each other.
Yeah.
The last point I'll make is there's some CDMOs truly believe I do have a technology that you have to pay the rights for it, which is also, the literature is so open. So, this is a new modality and all of that, and everybody trying to find a space in it.
Yeah.
And I am just blown away with how many CDMOs in the last year and a half has showed up for just mRNA.
Yeah.
Transitioning from protein to mRNA. So
yeah.
My this is the struggle that I always got. And the last one is, and that question came out in the chat, do I need to run all the CQAs on an RUO product? It's like the sponsors own everything. At the end of the day, they have to answer for everything. So my advice for the sponsor is get a CMC consultant if you can afford to hire, to draw a roadmap for you, to tell you exactly what you need, to go to the CDMO and say, this is what we need, and this is what we need to do if you can provide that for me. So my answer to this, testing all the CQAs, when you're developing, you want to test everything because that's your baseline. That's your database. After that you can draw, pull back, but in the beginning you should not.